Hello and welcome to my channel. My name is Anna and I am a registered nurse with experience in NICU and pediatrics. Today I'm going to walk you through the steps and protocols we follow in the hospital to ensure your baby is healthy and thriving in their first 24 hours of life. Keep in mind every facility is different and medical complications will require different steps, so stay with me as I share what is probably too much information. Obviously, you can expect the usual. Mom's waters break, contractions start giving you terrible back and abdominal pain, from what I recall at least, and everyone heads over to the hospital. If you're truly in labor, hooray, you'll be admitted, hooked up on all kinds of monitors, and hopefully, if you're up for it, given the good drugs for the pain. One thing to think about is yes, an epidural helps with pain relief, but it may also lengthen the time of labor by slowing the contractions. On the other hand, it allows the mother to rest and conserve energy since you have less pain. Your birth plan will be reviewed and general consent signed upon arrival. I wish you the best of luck and hope your birthing experience goes according to plan. Now back to your baby. Congratulations, your little munchkin has finally arrived. First things first, as soon as the baby is out, they will be given an APGAR score. Normally, it is assigned by the delivering physician or a NICU neonatologist if they're present at the delivery. APGAR is a quick assessment tool used to evaluate the immediate condition of a newborn. It is done at the first minute of life, 5 minutes of life, and if the baby needs a little help acclimating, they will be reevaluated at 10 minutes of life. The highest possible score that can be achieved is a 10, but nobody truly ever gets a 10. When they do, it's mostly because they seem to be really in excellent health and the physician is just saying that your baby is in A plus shape. There's absolutely nothing to worry about, no concern. They're crying perfectly, they're breathing, their heart rate's fine, their color is beautiful. But to be an absolute 10, the baby would have to be absolutely perfect, nothing wrong. Most common high score is usually a 9. The APGAR score is tested on 5 categories: appearance and skin color. Are they pale and bluish, nice and pink, including all extremities? It is completely normal for their hands and feet to appear bluish purple. It's called acrocyanosis and will usually resolve within the first 24 hours. Their blood flow is just starting to get going. Next category is their heart rate, pulse. Honestly, as long as the baby is not struggling, the pulse isn't counted, just palpated to ensure it is strong and present, and they're automatically giving the full 2 points for that category. Then we look for grimace or cry. As soon as the baby is out and has a good loud cry and continues crying, you bet we're 90% sure they are healthy. A loud, vigorous cry with wiggling gets the blood pumping and opens those airways. Of course, muscle tone is another category. If they're crying loudly and flailing in all directions, it's a happy sight. Last category is respirations. A good strong cry will help aerate the lungs. Sometimes you'll hear a gurgle in their cry. They just need to be suctioned to remove any excess amniotic fluid that they may have swallowed. Although there are 5 different categories, they're each kind of tied to each other. For example, a newborn with a low pulse will not have enough blood flow, causing slower, irregular respirations that will result in decreased muscle tone and appearance. And then, just for reference, a score of 7 to 10 is normal. A score of 6 and under will require some type of medical attention depending on the severity. Don't be scared until you know. I've seen babies start at a 4 and end at an 8 20 minutes later. Just let everybody do what they need to do. Once the APGARs have been assigned and baby has been evaluated by a physician if needed, I say this because if the APGAR was good and it wasn't a C-section, there were no complications whatsoever, the delivering doctor is focused on you, the mother, and the baby is waiting for a transition nurse to then take over. A transition nurse is a nurse specifically dedicated to taking over the care of the baby from the moment of birth and until it is transferred to the postpartum floor or NICU if necessary. A transition nurse will perform a full neonatal physical, including vital signs. How frequent the vital signs are obtained depend on hospital policy. Normally, the baby is placed under a radiant warmer for this assessment. There are specific protocols to follow if the baby is too cold or breathing irregularly. Remember, they just came out of the womb and need to acclimate outside the womb. Delivery rooms and ORs are usually cold for the purposes of infection control, and babies have limited brown fat when they're born to help them regulate temperature. At this time, they're also given the vitamin K, or phytomenadione, as the pharmacy calls it. Vitamin K is essential to the clotting factor cascade and is given to prevent vitamin K deficiency bleeding. It also helps line the gut in preparation for feeding. Normally, this is a quick injection given at the thigh. Your newborn will also receive an erythromycin ophthalmic ointment to prevent certain eye infections that can be caused by chlamydia or gonorrhea. We are not trying to say that you have those diseases, it is a preventative measure. You will be asked if we are authorized to administer these two medications normally when you are admitted. Along with the physical exam, a Ballard assessment will be conducted. Sometimes it may be performed by the pediatrician or resident, or not at all. The Ballard maturational assessment is used to estimate roughly how old the baby is gestationally and should somewhat match their estimated gestational age. If your baby is doing well and going on to the postpartum floor with you, good news, no more labs will be needed. Only the cord blood collected at the delivery will be sent out, which tests for the blood type, Rh factor, and other blood disorders. They will, however, be pricked for AccuChecks, which is testing their blood glucose level. This will happen regardless of whether the mother is diabetic or not. Hypoglycemia is a serious concern for newborns and must be monitored promptly. Can you tell I've been traumatized by this? Just kidding. As long as their sugar is over 50 3 times in a row, they are usually good by most hospital protocols. If they fall below 45, there are a series of standard procedures that must be followed to ensure that level rises, and there's more frequent monitoring. If you are a diabetic mother, some hospitals will do AccuChecks either hourly or every 3 hours. It just depends. Assuming there are no other problems with baby after their physical exam and transition process is completed, they are then swaddled and passed on to mom or dad. This is also a great time for skin to skin. Skin to skin not only helps aid in bonding with your newborn, but helps regulate their body temperature, which in turn helps regulate their breathing and affects their pulse and so on. This is the time when you may also start the first feed while you await your room in the postpartum floor. Recently, I found many facilities have done away with nurseries because studies have shown keeping newborns with their mother in the same room helps foster bonding and competence in care for their newborn. Now, I assume you've made it to your room on the postpartum floor. Hopefully, it's a nice one that's been recently remodeled with your own private bathroom, TV, additional guest bed. There are some that even look better than a hotel room. On many occasions, the same nurse who is in charge of your care will also be assigned your baby, but depending on the census, they may have a different nurse in charge of your care and another nurse in charge of the baby's care. If you're lucky enough, you'll have a wonderful NICU nurse that's floating to your unit and will be in charge of your baby, just like me. If your newborn has made it with you to the postpartum floor, good news. They are most likely doing great. They're considered to be in good health and thus will not be connected to any monitors. Their vital signs can be taken anywhere from every 6 to 8 hours, depending on the facility. They should be clothed and swaddled on their back, laying in the crib. I know they're so freaking adorable right now, but let them rest. They're used to being in the womb where it's nice and cozy and warm and dark and they're all cuddled up, so just keep the lighting and noise to a minimal. Remember, they grow while they sleep. Plus, I know you must be tired, especially if it was a hard delivery. All right, remember having your newborn in the same room is all about fostering bonding and instilling a sense of confidence and independence when caring for your baby. The nurse will most likely walk you through the first touch time, especially if it's your first time as a parent. Touch time is usually every 2 to 3 hours when baby feeds. They wake up to eat, so you will take this opportunity to change their diapers, do umbilical cord care, which just dabbing a little alcohol wipe on it for like the first 24 to 48 hours, wipe their face, change their clothes if needed. I'll tell you, every nurse does things differently, so you may pick up different little tricks and tips from each one. When it comes to feeding, remember they are brand new to this world. Don't expect them to chug 60 mLs on their first feeding. It is perfectly fine for them to eat only 15 mLs the first time, then 20, then 10. For reference, 30 mLs is the equivalent to an ounce. Their stomach is just learning how to handle food. If you plan to breastfeed, be ready to do so about every 2 to 3 hours, but breastfed babies feed more frequently. If you are doing formula, they will usually eat about every 3 hours. If there is a specific formula that you want to have, pack it with you. Most hospitals will just have you sign a consent for outside formula, but at the end of the day, it's your baby, and when you leave, you're gonna do what you want. I will say this about breastfeeding and the postpartum floor. It is said that breast is best, and I agree. But if needed to do so, do not be afraid to give baby formula. It is a myth that if they have formula or are bottle fed, they will reject breast milk. Also, keep in mind most hospitals will push breastfeeding because if they meet a certain percentage, they receive additional funding for exclusively breastfeeding patients. There were many times I floated to postpartum units and was told by the nurses on the floor that they would get lectured if they even offer the option for formula, which is sad, or that lactation consultants would refuse to work with mothers who want to breastfeed if they even gave a hint of formula. Personally, I don't agree with this. It really pissed me off. But if your baby needs to eat to maintain their blood glucose because it's low and you're too tired and not producing milk, I will personally encourage you to give formula. That said, you can immediately start breastfeeding or pumping as soon as you're medically stable, even if you're still on the L&D floor. Putting baby to breast and pumping will stimulate that milk production. You have to be consistent, otherwise, your milk will dry up. Don't get frustrated if you're not getting boatloads of milk. Most of the time, your main supply will start coming in around the third day. It's just the colostrum right now, which is incredibly nutritious for your baby. If you're not going to breastfeed, at least give them that colostrum. Quick tip is to take a notebook and make a chart so you can track the time of feedings and diaper changes. Nurses will ask you every 3 to 4 hours whether the baby stooled or urinated and how much they ate or how long they were on the breast. Poop is very important. We need to make sure your baby stools at minimum once within the first 24 hours of life to ensure that the GI anatomy is functioning properly and there are no obstructions. Further testing will be ordered if there's no stool whatsoever within the first 24 hours of life. During the first 12 to 24 hours of life, there are several orders that need to be completed for a newborn. Again, facilities differ in test and orders. Most of the time, their first bath will be after 12 hours of life. They will be taken to a designated spot to be bathed under a radiant warmer to help baby maintain their body temperature. If you want to be a part of the first bath, you can always let your nurse know and accompany them. This bath must be done quickly so that the baby does not lose too much body heat. Main goal is to clean them up, remove all the cheesy vernix they may have in their body folds and hair. After they are bathed and swaddled, their temperature will be checked in 30 minutes to ensure temperature regulation. If temperature is good, then the babies return to mom and dad. If not, they'll be kept a little bit longer to make sure that they're warm and their temperature is rechecked anywhere from 15 to 30 minutes. During this window, usually with the bath or with the labs, the Hep B vaccine will be given. This is completely up to the parents. It is your right to decline and think about it. If the baby does not get the vaccine in the hospital, your pediatrician will bring it up again during your first visit and probably further educate you on the benefits. Jaundice is a common disease process that occurs within newborns. It's a yellow pigmentation of the skin that occurs when red blood cells break. So, sometime between the first 12 to 24 hours, a non invasive diagnosis test called a TC Billy is performed. It's basically a small sensor that's pressed onto the baby's forehead 3 times in a row, and then the average is calculated. Based on the value, the baby is considered a low risk and then no further action needed. If the baby has a high value, then a blood sample is collected for confirmation, followed by treatment as necessary. Lastly, labs are drawn to check the newborn's CBC, which includes red blood cells, white blood cells, and platelets, accompanied by a lab for electrolytes to check the sodium, chloride, potassium. And also a PKU is collected, which can be called a newborn screening. A PKU test for a rare genetic disorder that affects the way the body processes phenylalanine. I'm sorry if I butcher that. It's a hard word for me. Individuals who cannot process this amino acid can accumulate harmful levels in the blood that can then lead to neurological problems, intellectual disabilities. So, this test is usually done nationwide. Even in many other countries, it is sent out and the results are normally forwarded to your pediatrician or they're communicated directly to the parent if there are any irregularities. Before I forget, while in the hospital, babies are weighed every night. If it's been more than 12 hours since their birth time, they will be weighed that night again. Now, keep in mind, because I know parents love to ask about the weight. It's the most common question that I got. Oh, how much did they weigh tonight? And they would freak out when they would see that the baby lost a little weight. It is completely normal for newborns to lose weight continuously during their first week. When they're born, they still have all the hormones and fluid that they obtained while in the womb that's affecting their weight, and then during that week they're obviously their body's regulating and they're losing all that fluid, so that's why the weight starts to decrease. Now, if the weight is still continuously decreasing after the first week, then that's when we would take it seriously and think that there is an issue and order more tests. But it's completely normal for them to lose 1 to 2, no, not 2 pounds, like 1 pound during the first week. Also, I know this is weird, but they can even have leaky nipples. Again, it's the hormones. I want to thank you for sticking it out with me for so long. I hope this video helps set realistic expectations and answers any questions that you probably didn't even know you had, and gives you a better view of what you can expect during your baby's first 24 hours in the hospital. If you found this video to be useful, don't forget to like, subscribe, and share your thoughts in the comments below. If there's any specific topic you'd like to know about, comment below and join us next time. As always, please remember this channel is for educational purposes. All information shared is based on my current cumulative knowledge, personal experience, and research. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Be sure to always seek professional medical advice from a qualified physician or healthcare provider with any questions you may have regarding a medical condition.